Continuing a series of definitions of terminology, we're going to turn to sex, gender, gender identity, and sexuality. Part of the social construction of sex and gender is the belief that many separate traits are inevitably related. In women's studies, we try and break those down. Sex and gender are typically used interchangeably, but in women's studies, we understand these to be distinct ideas. Sex is the physical, biological aspects of a person, their genitals, chromosomes, hormones, body shape, secondary sexual characteristics such as breasts or facial hair. Sex is constructed as binary, meaning there are believed to be only two options, what we call male or female. These two sexes are sometimes referred to as opposite, although it's important to remember that this too is a social construction. Gender is the cultural aspects of a person, the clothes they wear, the way they act, the job they have, the things they enjoy, the way they style their hair. Gender is also constructed as binary, what we call masculine or feminine. The assumption is that people's sex and gender will match, that male people will be masculine and female people will be feminine. This division between sex and gender can be useful, but it's also been questioned by modern scholars in women's studies. Our bodies are not physically immutable, but can be altered by the choices we make. If a person gets breast implants, for example, that is a physical change culturally chosen. There is nothing inherent, we argue, about the associations between biological traits and the sex we associate with them. In other words, the idea that a penis is male is socially constructed. For these reasons, you will often hear me refer to sex-gender. When a baby is born, they are typically assigned a sex. The medical professional says, "It's a boy," or "It's a girl." This, typically, is based entirely on the appearance of the baby's genitals. Our socially constructed assumption is that a person's genitals will predict all other aspects of their sex, that a person with a penis will have XY chromosomes, testosterone as their dominant hormone, will develop a male-appearing body, grow facial hair, and so forth. This assumption is incorrect. Many people have a mixture of traits. Sometimes the genitalia of a baby is considered ambiguous. The doctor cannot tell if the baby is male or female by looking at their genitals. These people are called intersex. People may also find out they are intersex later in life, after a chromosome test, for example. Intersex manifests in a wide variety of ways, but what all intersex people have in common is that their bodies do not conform to the social constructed sex binary. People also have a gender identity, which, just to be confusing, is the sex they believe themselves to be. A person who says, "I am male," has a male gender identity. For some people, their gender identity is the same as the sex they were assigned at birth. These people are called cis, spelled C-I-S. A cis woman is a person who identifies as a woman and was assigned female at birth. A person whose gender identity is not the same as their sex assigned at birth is trans. We refer to trans people by their gender identity, not by their sex assigned at birth. So a trans woman is a person who identifies as a woman and was assigned male at birth. We use she to refer to her. Trans people may or may not undergo a variety of gender-confirming actions, including using a name and pronouns appropriate to their gender identity, wearing clothes commonly associated with their identity, or taking the hormones associated with their gender identity, and potentially having medical procedures to allow their body to conform with the expectations of the body of someone with their gender identity. Someone is trans based on their identity, regardless of which of these actions they choose to take. Some people have a strongly held binary gender identity. They're either male or female. Some people do not. Such people might identify as genderqueer, non-binary, or agender. Sexuality is the term we use to describe the interaction between our sex gender and the sex gender of the people to whom we are attracted. Heterosexual or straight people are binary sex gender people attracted to people of the opposite, in quotes, sex. Homosexual or gay people are binary sex gender people attracted to people of the same sex. Bisexual people are attracted to both sexes, although today many bisexual people are also attracted to non-binary people. Pansexual people are attracted to binary and non-binary people. Asexual people do not experience sexual attraction. Some homosexual, bisexual, pan, and asexual people may identify as queer. This is a term that has been reclaimed by people within the community, but may be offensive when used by people outside of the community. Note that any of these sexuality terms are applicable for people of all genders and gender identities, so a trans person can be homosexual, heterosexual, or pansexual. Sexuality is not as simple as attracted to implied by the previous definitions. People may have different sexual, romantic, friendship, or companionship attractions. People's sexual practices are also not necessarily the same as their sexual identity. For example, some men may have sex with men and identify as heterosexual.